Good morning, Ananda. Myself, P.NITHISHKUMAR, working as a tutor in Shree Venkateshwara College of Physiotherapy, Tamil Nadu, India. Before getting to the presentation, first I would like to sincerely thank Inti International University for giving me this opportunity to present my work. I'm going to present a topic on efficacy of moderate intensity interval training exercise to regulate insulin resistance and salvage the liver function in type 2 diabetes mellitus patient with metabolic dysfunction associated steatic liver disease. So, introduction. Metabolic dysfunction associated steatic liver disease, previously which is termed as a non-alcoholic fatty liver disease. So it is defined as steatic liver disease in the presence of one or more cardiometabolic risk factor, which is include type 2 diabetes mellitus, and there is a changes in the intermediate hyperglycemic changes, and as well absence of harmful alcoholic intake. That's why which is termed as a non-alcoholic fatty liver disease. The changes in nomenclature, which is because of there is a n number of changes in metabolic, that's why they are changed from non-alcoholic to metabolic dysfunction liver disease. Type 2 diabetes mellitus is associated with a spectrum of liver abnormalities, among that which is known as metabolic dysfunction associated steatic liver disease, which is characterized by increased intrahepatic triglyceride content, that is a fat deposition, that is namely called as steatosis, either with or without inflammation and fibrosis. Metabolic steatic liver disease is the most common chronic liver disease which is closely linked with type 2 diabetes mellitus because of intermediate hyperglycemic changes and as well obesity. In addition to adverse liver outcomes, metabolic associated steatic liver disease is associated with increased risk factor, adverse risk factor in cardiorenal outcomes as well. So when we talk about the prevalence, the global prevalence of MASLD in people with type 2 diabetes mellitus is 65%, and the metabolic dysfunction associated with this hepatitis is 32%. So when we talk about the spectrum, the course of liver disease, the first which start from metabolic dysfunction associated steatic liver disease, followed by there will be a inflammation, that is we call it steatohepatitis, and followed by there will be a development of fibrosis and cirrhosis, and finally there will be a development of hepatocellular carcinoma. So the natural history of MASLD is relatively well defined. So there are some substantial individual variability in the disease trajectories. The future risk of disease related, that is liver related events, starts increasing the fibrosis stage. However, it takes decades to develop MASLD to progress from liver fat deposition from cirrhosis to hepatic decompensation. So the changes in the dynamics of MASLD management in type 2 diabetes mellitus, so which is now necessitated individualized strategic ground in the key pillars of diabetes management has to be there. It has to be targeted therapy, and it has to be available, accessible and inexpensive form. So when we talk about the exercise, the exercise is a form of available form, and everyone can easily accessible, which is a form of inexpensive, we can easily get it. So in a recent review, the on behalf of Exercise and Sports Science Australia has present has given regarding a role of exercise in the management of MAFLD. They strongly suggest that 150 to 240 minutes per week of at least moderate intensity aerobic exercise can lead to moderate absolute reduction in the hepatic steatosis by 2 to 4%. As well, the American College of Sports Medicine recommend at least 150 minutes per week of moderate intensity or 75 minutes a week of high intensity or vigorous intensity physical activity for all individuals with those who have non-alcoholic fatty liver disease, including metabolic associated steatic liver disease. Now, it is worth to emphasizing that the objective of present review is to provide update information on various exercise program modalities. As well, it is shed light on the key molecular pathway that play a significant role in metabolic associated steatic liver disease to salvage the liver function, as well to regulate the insulin resistance among type 2 diabetes mellitus patients. So coming to the aim of the study, so the aim of the study is to find out the effect of MIIT exercise on insulin resistance and liver function in type 2 diabetes mellitus patient with MASLD. Coming to the objective, the first objective of the study is to evaluate the effect of MIIT exercise to regulate insulin resistance in type 2 diabetes mellitus patient with MASLD. The second objective is to evaluate the effect of MIIT exercise to salvage the liver function in type 2 diabetes mellitus patient with MASLD. Coming to the hypothesis, the null hypothesis states that there is no significant impact of MIIT exercise on insulin resistance and liver function in type 2 diabetes mellitus patient with MASLD. Coming to the alternative hypothesis states that there is a significant impact of MIIT exercise on insulin resistance and liver function in type 2 diabetes mellitus patient with MASLD. Coming to the methodology, the study design is the randomized control trial with true experimental study design with active control parallel group. The study population was performed on type 2 diabetes mellitus patient with metabolic associated steatotic liver disease. The study setting, the study conducted in Cambridge Specialty Hospital, Department of General Medicine and Erode. Sampling technique, the subject were included with convenient sampling technique. The sample size include 30 subjects. The total study duration is 1 year. In that, the 24 weeks of treatment duration for the both groups. Coming to the selection criteria, the inclusion criteria are age between 45 to 65 years of both gender, that is male and female. The subject has to be diagnosed with type 2 diabetes mellitus and then metabolic associated steatic liver disease based on International Diabetic Federation criteria, and the subject having FIB score 4 value greater than 2.67 and elevated ALT level greater than 30 UL. Subject with good glycemic control. These are all the inclusion criteria. So coming to the exclusion criteria, the exclusion criteria are uncontrolled diabetes mellitus and hypertension, and I have excluded those who are chronic smoker and alcoholic, and I have excluded participation with neurological disorder, and I have excluded participation with hemodynamically unstable. So these are all the exclusion criteria. So coming to the variables, the independent variable is moderate intensity interval training exercise. The dependent variable are regulation of insulin resistance and salvage the liver function. Coming to the group allocation, since I have got 30 subjects, I have divided into two groups, that is group A and group B. The group A, which is namely called as experimental group, which is comprises of 15 subjects. They are underwent moderate intensity interval training exercise. And then coming to the group B, which is namely called as control group, they are comprises of 15 subjects. They received conventional therapy. Coming to the outcome of the study is regulation of insulin resistance and salvage the liver function. Coming to the outcome measure, the insulin resistance were assessed by using HbA1c test, that is a glycolated hemoglobin test, and liver function assessed by liver function test. Among the liver function, we have got n number of enzymes are there. Among that, I have chosen ALT, amino transaminase, as a parameter. Why? Because which is specifically assess the cellular activity of the liver. That's why I have taken ALT as a biomarker in liver function. So coming to the statistical tool, I have got two statistical tools. The one is paired or dependent t-test to analyze within a group, and another one is unpaired or independent t-test to analyze the between group. Coming to the methodology, so in methodology, exercise intervention, as I said, I have got two groups, experimental group and a control group. The experimental group receiving exercise of moderate intensity interval training exercise. Each training session of moderate intensity interval training exercise program given through treadmill running and a bicycle ergometer for a period of 45 minutes thrice a week, based on American College of Sports Medicine protocol. So the 45 minutes of exercise program have divided into three phases, that is warm up phase, cool down phase and the exercise phase. The warm up phase, which is given for a period of 10 minutes, they underwent low intensity exercise such as march on the spot, hail digs and etc. So coming to the exercise phase given for a period of 30 minutes. I have given a main exercise program, that is moderate intensity interval training through treadmill and bicycle ergometer. Since it is an interval training, I have given intervals, the intervals which is consist of active break. I have given the 3 exercise interval which is lasting 3 minutes. So since it is a moderate intensity, I have set the intensity level of 50 to 60% heart rate peak, which is equaling to the 5 to 6 on the watt scale. So coming to the cool down period, which is consists of 5 minutes. So coming to the control group, they underwent conventional therapy such as walking, were provided for a duration of 45 minutes. So coming to the data analysis, so these are all the demographic, homo and heterogeneity analysis of demographic analysis of age, female, male and FIB 4-score glycemic control of mean variables of both group A and group B. So coming to the main data analysis part, the first tabular column showed within a group analysis of group A and group B of liver function test, that is ALT level and insulin resistance of HbA1c level. So we can see through that group A has got improvement than the group B, especially while looking post mean values of both group. So there will be a good reduction in the HbA1c level and there will be a good reduction in the ALT level comparing the group B while group A. So group A has got significantly improved than the group B at the level of significance of 0.05 by looking through t value. Coming to the second tabular column, the second tabular column shows that between group analysis of group A and group B of liver function, that is ALT, and insulin resistance of HbA1c level. In that we can see through that there will be a significant differences in the values of ALT and HbA1c level at the level of significance of 0.05 of both values of ALT and HbA1c level, which tells that there is a significant improvement in the ALT and HbA1c level by giving moderate intensity interval training exercise in group A than group B. So these are all the graphical representation of post intervention, that is a post and post test values of group A and group B. We could see there will be a drastic improvement in group B than group B of HbA1c and the ALT. So coming to the result, in group A, there was a significant reduction in the HbA1c level at the level of significance of 0.05 and ALT level at the level of significance of 0.05, which is indicating there will be a very good improvement in the insulin sensitivity and liver function. When come to the in group B, the changes were not statistically significant at the level of 0.05. Coming to the unpaired t-test, which is revealed a statistical significant difference in the post-intervention of HbA1c and ALT values between group A and group B at the level of significance of 0.05. Henceforth, the statistical analysis shows that there is significant improvement in both group, but comparing the both values of both group A had significant improvement than group B at the level of significance of p-value 0.05, which is 2.13. Hence, the statistical report said that there is a significant improvement in insulin resistance as well salvaging the liver function as well rejuvenation of liver function by application of moderate intensity interval training exercise in group A than group B. So alternative hypothesis has been accepted and null hypothesis has been rejected, and hereby we are proving type 2 error, type 2 hypothetical error. That's why we are accepting null hypothesis and rejecting alternative hypothesis. And the obtained statistical values of experimental group not only improved clinically as well statistically, that because of good regulation in the insulin resistance and the rejuvenation in the liver function in type 2 diabetes mellitus patient with MASLD. Coming to the discussion, the findings of present study revealed that after 24 weeks of training program, there is a significant difference in the values of insulin resistance and liver function test parameters such as ALT in experimental group who have received moderate intensity interval training exercise than control group. There are few emerging drugs to manage the MASLD treatment such as GLP-1 agonist. But the widely adapted first-line treatment for MASLD remains weight loss through portion control, that is diet and exercise training, especially in patients with type 2 diabetes mellitus. Exercise has been shown drastically reduction in the ALT, insulin resistance, and the grade of liver stasis, that is a deposition of fat. As well, the moderate intensity exercise is a very good concentration in the muscle function. So the muscle function also has a reciprocal relationship with MASLD. So as well, the study have been showed that individual with reduced muscle mass at highest risk to developing MASLD, even when risk factor like there will be a development of insulin resistance and a inflammation are accounted therefore. So skeletal muscle index has a converse relation with markers such as homeostasis, insulin resistance, and CRP triglyceride and overall fat percentage in the MASLD, even after adjusting potential confounding factor. It could develop further or it could worsen further to develop metabolic thing. So the aerobic exercise such as moderate intensity continuous training, cycling or swimming has emerged as a promising intervention for individuals with MASLD. As well, it is a low cost, accessible form of exercise that has demonstrated significant positive effect on various metabolic parameters with certain limitation in patients with cardiovascular disease and elderly population. Several clinical trials have been showed that aerobic exercise can reduce body mass, percentage of fat mass and total fat mass. But a recent meta-analysis showed improvement in lipid level, particularly reduction in the LDL cholesterol level, thereby increase in HDL level, thereby we can reduction in the triglyceride, thereby we can reduce the fat deposition in liver, thereby we can prevent or we can control the fat deposition in the liver. So we can rejuvenate or regain the liver function easily by giving these kind of aerobic kind of exercise. So furthermore, aerobic exercise has been shown to increase adiponine level, which is crucial mediating the inflammatory process associated with obesity and liver disease. So several studies have been potentially effectiveness of exercise program, mostly aerobic exercise, which is the fat deposition we can regulate through beta oxidation, and down we can regulate the down regulation of lipid synthesis in the liver through this aerobic exercise program. So standardized physical activity prescription of MASLD remains unchallenged, but based on the guidelines, they are recommending a management of 150 to 200 minutes per week of moderate intensity aerobic exercise physical activity session, 3 to 5 session. As well, the American Association for Study of Liver Disease recommend that greater than 150 minutes per week of moderate intensity for these people. So anyhow, the adherence is a challenging factor while setting the exercise protocol. So adherence to the any type of exercise represents the issue for the many people. In study of patient with MASLD, Stein et al. Found that 75% of patients are failed to achieve prescribed greater than 150 minutes of week of physical activity continuously. That's why in our study we are setting moderate intensity interval training instead of continuous in nature. Why? Because the interval training can provide a very good adherence capacity to withstand the exercise program. A lack of resources and education from their treating medical provider physical discomfort and time restriction were a major barrier to identified by the patient in the adherence manner. So therefore, the moderate intensity interval training exercise with the treatment duration of 24 weeks or 45 minutes per day thrice a week, which is a very good adherence among this patient in our study. So we emphasizing the importance of physical activities for rejuvenating the liver function, that is to decrease the liver function, to decrease the fat deposition in the liver, as well to regulate the insulin resistance in patients seeking greater compliance in long-term benefit. So the present work reveals that the moderate intensity interval training exercise was most tolerable, enjoyable for the patient with type 2 diabetes mellitus along with metabolic associated steatotic liver disease. So coming to the conclusion, the study finally concluded that the study was highly significant impact in regulation of insulin resistance and rejuvenation of the liver function with chronic salvageability by application of moderate intensity interval training exercise in type 2 diabetes mellitus patient with metabolic associated steatotic liver disease. So coming to the limitation and future scope, the study variability in the age, medication use, disease severity, comorbidities such as obesity and hypertension, and baseline fitness level can confound outcomes. So these are all the limitation. So therefore, further study that include combined intervention with those exercise alone evaluate the potential exercise form. Additionally, more variables should be measured such as ethnicity of population, lifestyle habit of the patient and the pathological process of the condition that can guide us generate increasingly strategy for MASLD patient. As well, usage of wearable or supervision to track the adherence and intensity compliance in MIIT program. So these are all my reference. Thank you.